today with Thomas Ding, who is at the College Conference in Auckland, and he's been talking to us about some research you've been doing in general practice.
Yeah, no, thanks so much for having me.
It's a pleasure. And you are a trainee intern?
I am,
Yep.
yes.
Yep.
Yeah. So I'm currently training in Dunedin, but it's highly it's more varied than just Dunedin. I've done things in Invercargill and South Canterbury. I'm doing my GP placement up in Auckland at the moment, actually.
Wow.
Yeah.
Okay, that's sort of slightly cheating.
It is, a little bit, yeah.
And so in the research you've been doing, you took a year out when?
So I was a little bit unconventional. I took a year out between 5th and 6th year, and between 3rd and 4th year I had no inclination of wanting to do research. Didn't come into medicine to do research and not to sit behind a computer. But I think, as you move on from 4th and 5th years, you see how integral evidence-based medicine is to every discipline, and that applies to general practice as well. So decided to take a topic from the experiences that I had and turn that into some clinical research in a BMed site.
Oh, cool. And so I've just been to your little lecture, which is really interesting. I think, could I do that in my practice? So tell everyone else what you've been researching on.
Right. So I've been looking at a tool called the ankle brachial pressure index, or the Abpi, which some people will be familiar about. It's essentially taking a blood pressure of your lower limbs and your upper limbs and comparing that to create a ratio, and anything under 0.9 is diagnostic of peripheral vascular disease, and anything under 0.4, 0.5 is severe peripheral vascular disease. So huge implications for general practice, with aiding referrals, helping with diagnostics, helping with ruling out of PAD so you can start compression bandaging for those with venous disease, and taking a look at how this tool that we use all day, every day in vascular surgery can be implemented in general surgery, as a lot of the secondary care procedures are being moved into the community these days, aren't they?
Yeah, they are, And I think you said in your lecture that if I could do it, then anyone could.
Yeah, pretty much.
So that makes me feel more confident. And you were saying the accuracy for the actual procedure is really good, isn't it?
Yeah, so the ABPI has a specificity rate of over 98%.
That's amazing.
Absolutely. Sensitivity, upwards of 90%. And the variability when they taught registrars and people who, compared to you guys, had a lot less experience, there was only a 9% intra-observer variability, which means, yes, sure, I may get a 0.9 as a 0.8, but that's not going to significantly alter my management. So that's excellent in terms of reproducibility.
Oh, that's great. So it makes me feel like I've read about it before, and I was thinking could I do this? But having listened to what you said, I think probably it's a good idea to sort of explore it anyway. So it's great. So how's it been for you being at the conference here as a trainee intern?
Yeah, no, the conference has been excellent. Everyone's been supportive and welcoming and really encouraging and fostering us as sort of up and coming practitioners into the profession. Lots of amazing, inspiring speakers, all the way from upper end policy, the big man, down to real practical local initiatives that have worked and have evidence behind them, but do really focus on that human side as well, which is what I really like about general practice.
Well, that's great. And I know that I found it difficult to choose my profession as I went through because everything was exciting. So how do you feel about general practice?
So I think I was saying this to you before, I sort of change every 5 seconds, and I think that's sort of reflects my sort of passion in doing lots of things. And general practice is one of those fields where you can get stuck in and doing a little bit of everything. And you do have long and short-term relationships with people to different types of continuity and different types of connection with other specialists and interprofessional practices and communities.
I'm glad you've come. It's really great, and I hope you enjoy the rest of the conference and enjoy your attachment, even though it is in Auckland.
It is, I know.
It's a bit of a worry, but and really enjoy your time there, and thanks for talking to us today.
Great, thank you so much for having me.
Pleasure.